IVF is a $24 billion industry.
But a lot of women just get bullied into things that maybe they don't want to do.
When we feel there's something out there that we need to try, you should definitely do that.
Absolutely, explore it. But a lot of these doctors are so close-minded to trying experimental therapies.
That's absolutely correct.
Guys, welcome back to another episode of Biohack-It. And today's guest is somebody I discovered last year. So when I started my fertility journey, I had so many questions. And first I was going to go the IVF route. And you've seen me transition on this podcast. You've seen me interview a lot of incredible fertility doctors and thinking about signing up for IVF and then being like, hold on. I know enough about the space. I'm learning. And I had two fertility doctors that really backed me to say, let's heal your body. Let's get it down right. And let's really help your body heal for you to conceive naturally. And so that's a journey that I've been on. And my guest today, I was told about her from a really famous midwife that lives in LA that said to me, have you heard of the Mercier method? And I was like, no, what is this? They're like, Jennifer Mercier is this incredible doctor. And she started this thing called the Mercier method, where she helps women conceive naturally. So out of curiosity, I started digging, and I found her just fascinating. Her success stories, how she's working with women to heal their bodies, get them back in touch with themselves. And the amount of women who were told that you need IVF and she's helped them conceive naturally is just incredible. So I'm excited to bring her onto the show today. Thank you, Jennifer, for being here.
Thanks for having me.
So tell us, I'm going to get right into it. Mercier method. What is it? What do we need to know about it?
Yeah, Mercier therapy is a deep pelvic organ visceral manipulation. I use my hands to go in transabdominally, transpelvically, to manipulate the pelvic organs, the uterus, the ovaries. I can't feel tubes with my fingers. I would need ultrasound for that. But all of the surrounding structures just to mobilize and restore blood flow. And that will optimize overall pelvic organ, reproductive organ function.
And how did you discover this, that women need this?
Yeah, I discovered it based on a need for myself. I mean, I was diagnosed with aggressive stage 4 endometriosis when I was about 26 and had my first laparoscope at that point. And the solutions for pain management control was Lupron suppressive therapy or oral contraceptives. And I thought, well, I'm not injecting Lupron because that puts women into a temporary state of menopause, but I'll try the oral contraceptive. And that was, oh my gosh.
You probably felt like shit on it.
It was wretched. The headaches I would have, I would take Vicodin.
Swings. Yeah,
it was awful. And so I thought there's got to be a better way to manage this pain because it was so terrible. I was studying midwifery at the time, and I'd get up in the middle of the night to go to a birth, and the pain would just stop me cold. And I'd know I'd have to be up for a long period of time and be sharp and be on my toes, and it just was awful. So I kind of started poking around on my belly one night, and it was painful. It was painful.
Because of all the inflammation in there?
Oh my gosh, yes, it was terrible. So I just kept working. And as I would work through the pain and the pain would dissipate, I thought, oh my gosh, the pain's gone. It's literally gone. And with my next period, after kind of poking around, not really knowing too much about what I was doing, I had no indication that a period was going to start with the next cycle. And that was so unusual for me. The cramping and the abdominal pain and bloating and the fatigue were just so heavy that I wasn't used to a period just starting like that.
So that was actually the first time you probably had a full-blown period in a long time.
It was because I wasn't on oral contraceptives with experiencing a medically induced bleed.
And since then, how many women have seen you and how many families have you helped?
We've got to be close. We've got to be in the thousands now.
Wow.
We have to be because I literally 25 years in 2025 is exactly where we are. So Mercier therapy is 20 years old when I really brought it out to my practice, but about 5 years kind of tinkering around with the protocol and how to implement it in practice.
And so in practice, in theory, does this mean that basically the blood, like the organs require more blood flow in order for conception, right? And so is that what the method is doing? You're going in, you're manipulating it to bring more blood flow into each reproductive organ?
Yeah, that's correct. And I mean, I would liken it to an example of if you had some sort of issue with your shoulder joint and you were a pickleball player, you couldn't really get the range of motion necessary to be successful in pickleball if you didn't have some kind of rehabilitative therapy or range of motion rehabilitation. So it's the same with the pelvic organs, especially if there's disease process like PCOS, fibroids, even polyps in the uterus and endometriosis. There's some kind of disease process. And especially if that disease process was discovered by surgical method, you're going to have some scar tissue there.
Right.
And that scar tissue is going to lock everything down and in place. And if you're stuck in place, say I sit in this chair all day long, and then I get up after 8 hours and I start to move around, I'm going to be stiff. It's the same thing for your internal organs. You have to move them.
And most women don't even know about this. This should be part of like women's health, generally taught, practiced. How many women, I mean, I've never had my internal organs manipulated. So how many women are going through life without even doing this?
Right, a lot. I would say that I get my hands on maybe 1 or 2% of women that have had C-sections and they're recovering from that kind of aggressive scar tissue. I maybe see 1% of the women that have fertility challenges, maybe even less than that. I don't have a high volume clinic, but I have trained professionals all over the world. And we're about to be in 23 countries as of the training in October this year.
And how many sessions typically does somebody need?
6.
6 sessions. Okay. And back to back or spaced out? How does it work?
We can do it however we need to. So if a woman is preparing for a frozen embryo transfer or she's preparing to start stim for IVF, we can wrap it up in 4 days.
Right.
So I would do 90 minutes a day for each day consecutively. And yes, it can be really intense, but so is IVF. So is anything else we do in our life can be a bit intense. So if you can get through it, I can really help to optimize the overall outcome of what you're trying to achieve.
And what's the discomfort level?
So for women that have endometriosis, they're the gals that typically have the most tenderness post-session, tenderness post the first session. Mm-hmm. And then when I've broken through that kind of pain barrier, they tend to do really, really well. And they're just really surprised at the outcome and how well they feel and how much pain has been reduced by just one session.
Right.
It's crazy.
And isn't it crazy also the amount of women, young women and older women walk into a fertility doctor's office and the first route they give you is like, you have to do IVF because your time's running out, but they don't address anything when it comes to root cause, inflammation, insulin resistance, your metabolic health, just none of it is actually, they don't even run a full thyroid panel half the time.
They do not. You're right. I was a clinician in reproductive medicine in the early 90s before I went to school for naturopathic medicine and midwifery. What I noticed then is still what's happening now, meaning they kind of do the key labs and the key
standard of care.
Yeah, and we can't make this cookie cutter. We have to
individualize it.
We have to make it individualized for each woman. And so what I noticed back then is we had two primary drugs, Pergonal and Metrodin. Now we have well over 2 drugs, and we don't even use those 2 drugs any longer. We use those drugs in a different way paired up with sister drugs. But we were putting so many women through IVF protocols that potentially could have gotten pregnant on their own. And that's still the same for today. I mean, we're looking at a 48-year-old branch of medicine that does not have perfection, but IVF is there if we need to utilize it for a medically indicated reason. And I've got couples that come to my office and we prepare them because I say that going through IVF is like signing up for a 26-mile marathon and just showing up the day to run. And you have to prepare yourself. Yeah, totally.
If you're serious about your long-term health, there's one vitamin you're probably not getting enough of. No matter how clean your diet is, nearly 97% of people in the Western world are deficient in vitamin K2, and most don't even realize it. That's why K2 is nearly non-existent in modern diets, but it plays a huge role in heart health, circulation, bone strength, and even brain function. So here's why it matters so much. Low K2 levels can show up as weak bones, stiff muscle, bruising, wrinkles, and even forgetfulness and brain fog. It also is linked to major cardiovascular and bone health issues down the line. That's why I'm so excited about Just Thrive's K27, the only K2 supplement on the market that comes from 100% organic chickpea natto, the best source of K2. Delivers 320 mcg of pharmaceutical grade K27, the optimal daily daily dose, has guaranteed potency so your body actually absorbs what it needs. It's microbiologist formulated, clinically tested, and supports your heart, bones, brain, and circulation at the source. I've made it a part of my daily routine, and I think you'll love it too. Check it out at justthrivehealth.com and use code Biohack-It for a discount and enjoy. What are some of the tools and the tips or protocols maybe that you put these couples on to prepare if they decide to go the route of IVF?
Yeah, so we use different supplementation based on what the labs are looking like and the egg reserve looks like. I'm trained to look at semen analysis and all of the components that go along with that. So if there's a morphology issue or motility or overall count issue, I use specifics to guide couples towards the best place wellness in their wellness journey. I meant to say before, reproductive restorative medicine is what I practice. And plenty of OBGYNs that are trained to operate very carefully on reproductive organs are also doing this reproductive restoration so that couples can not be decoupled in the process and conceive their own babies. And if we can do reproductive restorative medicine for couples that do need IVF, they're going to go in strong. They'll go in strong and they'll be all the better for it than just signing up and starting, right? And just starting all of these aggressive stimulation protocols. I think we're doing a great disservice to couples when we're just putting them right into IVF protocols
without really prepping them emotionally or preparing their bodies.
100%. I mean, these reproductive endocrinology and fertility clinics are starting to use some supplements, which is, barely. I mean, that's the good old college try, but that's just scratching the surface.
So it's crazy that you say that because when I started exploring my own fertility journey, I literally went from the East Coast to the West Coast interviewing I think maybe 10 fertility doctors. Yeah. And only 2 of them, who are the ones that I'm actually working with, who I love, are a little bit more functional, alternative. And they're the ones who spoke to me about a lot of this different type of supplementation, experimentation. And they said, listen, if this is how you want to do it, then it's about fixing your levels. And I think you should go on all of this additional stuff, which a lot of the other doctors I interviewed on the podcast did not recommend.
Yeah. Isn't it surprising?
They didn't suggest it.
But here's the thing too, we're dealing with a $24 billion industry. Mm-hmm. So IVF is the revenue builder of the branch of medicine. And I have really great reproductive endocrinologists that I work with locally back in my practice that I trust implicitly. But I also know that their ultimate goal is to push every woman through IVF, unfortunately, because they believe that their way of medicine is the only way that works.
Right. That's all they were trained to look at.
Correct. And I mean, I think that we can all play nice in the sandbox. We all need to come together for the common good, the greater good of the couple that we're taking care of.
And also listen to them. Each couple is different. I was very clear that I did not want to go down the route of IVF at some stage. I did the testing, all this stuff, and said, you know what, I want to do it differently. And if I had doctors, thank God they're not like that, but the 2 that I'm working with, if they had said to me, no, we're not going to work with you, or this is the only way, then I would have gone and find myself another doctor. But most women don't advocate for themselves in that way, right? It's because I'm in the industry. I know so much. I can go find somebody else. I have enough friends in the space. But a lot of women just get shut down, disappointed, and are almost bullied into things that maybe they don't want to do.
Agree 100 with you on that one. When you're an educated and wise consumer, you can go in and ask the questions and feel comfortable in receiving whatever answer it is and then making a choice on, okay, am I going to work with this person or not? Because ultimately, we're your employee. And if I work for you, I want to make sure that I'm covering all of the bases that make you feel comfortable in working with me. And if it doesn't feel right, there's no pressure to work with me.
Right.
You know what I mean? But in reproductive medicine, it's a hard sell. Oh, we're going to get you pregnant. And I think that's so dangerous. I've seen it so many times. We're going to get you pregnant. And I think that's very dangerous to say to a couple.
And setting them up for false hope, because they can never tell you how many rounds you need. They never know how long it's going to take. They don't know, is it going to take months, weeks, years? How many cycles? Are you going to be able to do it with your own eggs? Are you going to need donor eggs? They can't give you a definite outcome. But as experimentative as this field of medicine is, because think about it, fertility, IVF really started 45 years ago. It's a field based around experimentation, but a lot of these doctors are so close-minded to trying experimental therapies such as PRP or stem cells for the ovary or trying different sort of supplementations and different dosages. I think there are very few doctors even looking at the research around rapamycin, the study that was done in Colombia, and they're about to publish it. It was done on women. It slowed down ovarian aging by 20%, which is adding like 5 years of somebody's fertility life. But they don't want to pay attention to that stuff because they're like, how do we make money? We make money through getting you through a cycle of IVF, whether it's you that compensates us or your insurance company. That's how we do it.
Correct. That's absolutely correct. Yeah. I mean, to start and complete a cycle is payment for them. To interject any kind of ovarian rejuvenation like PRP or stem cells or anything like that, that is out of their wheelhouse. And you know what? To their credit, these guys are real busy. These guys and gals, they're real busy because you know what? They've got 200 patients rotating through their practice for every cycle. And they've got to get every woman synced up in their cycle to do the same, like the retrieval within 1 to 2 days of each other. If these doctors don't have an OR or a procedure room and they're renting from a hospital and they have to have an embryologist, on for that same period of time for retrieval and then ICSI and making the embryos and freezing them and watching them and all of the things, they're going to sync up every woman in the same cycle. And it's that they don't have time to do anything else. But here's where there's another facet. So let the people that are doing this work, let them do their work and then you do your work. And again, we're all collaborating for the greater good of the couple. And not to dissuade a couple from doing something unless it's absolutely unsafe.
Yeah.
Right? But we have to try some of these things, especially for women that have very low AMH levels. And if that's your wish to try something like that, you should. I believe that when we feel that there's something out there that we need to try, you should definitely do that.
Absolutely. Explore it.
Yeah.
So I want to get into my labs because I send them to you and I wasn't even able to talk to you about them. I said, let's just do it on the episode. So I sent you my labs back from pre-December, right?
It was November. Yeah.
Yes. And then I just sent you over the labs the last like 90, 100 days or whatever.
Yeah.
So I want to hear what you saw or thought or whatever it is.
Absolutely. So from the initial set of labs you sent me was the ovarian reserve labs.
Yeah.
So LH, FSH, AMH. I think there was an estradiol and a progesterone level in there. All in all, like your estradiol and progesterone levels looked decent on day 3. And if either of those or both of those lab levels are elevated, that could suggest a diminished ovarian reserve. You do show a diminished ovarian reserve just by your AMH being very low. But here's the thing. I've seen women with undetectable AMH still get pregnant. We work together. I put them on the diminished ovarian reserve protocol with high DHEA supplementation along with pregnenolone and all the good fortification, preconceptual stuff for egg quality. And I always tell women that have a low AMH to picture an egg carton with 12 eggs in it. And that's you at 20 to 30 years old. And then when you get a little bit older, after age 35, you might only have 6 eggs in the carton. For you, Iman, you might have 3 eggs in the carton and one of them has a crack in it. So the one with the crack, it can very well ovulate and conceive and maybe end in a miscarriage because the egg quality was poor. But you have 2 eggs left in the carton and you may only ovulate twice a year. So we have to prepare you up for when you do pass one of those really good quality eggs. And then we have to make sure that your lining is thick enough and that you're supported in your luteal phase with progesterone and you're timing your LH surging and intercourse at the right time. That's without intervention. Now, for women like you that want to do something more aggressive, a little more aggressive like IVF, I recommend a mini IVF. Something where you're not really stepping on the gas pedal all the way to the floor, but you're maybe just giving a little bit of gas just to kind of see what you're capable of doing to see if we can hone in on 1 good egg or 2 good eggs and then doing ICSI or even doing a natural IVF and allowing the sperm to
do its thing.
Yeah, do its thing. Do its thing because sometimes that force via ICSI isn't great either. And there are studies showing that can harm the baby long term with blood pressure and just like long-term health and how it's not maybe the most favorable situation.
So the big thing that changed for me was I did this PRP back in October and the stem cells, I wasn't really ovulating. And since then, my cycle started getting regular and I started then ovulating. And I'm using this thing called Anido to track my cycle basically. And in that tracking of the cycle, it's basically showing me my time of the month when I'm ovulating, and everything is adding up pretty systematically. So one of my fertility doctors was like, okay, you can try naturally because we're able to track your cycle. We're able to exactly see when you're ovulating. We know when that is. Your, LH is surging at the right time. After you've tried the 2 weeks prior to seeing, they put me on progesterone. So I was just excited to even get to this point because prior to this back in November, I wasn't even having this. My cycle was not even regular. So I was just fascinated with tweaking my supplements, cutting inflammation from my body, tweaking my nutrition. And then from there, basically doing these other things like stem cells and PRP and how my body responded really well to it.
Yeah, that's great. I would also ask if on the Anido app, are you seeing a very strong LH surge?
Yes.
You are? Okay. Because even just doing an injectable HCG 10,000 IU along with the LH surge can mature the egg and release the egg. And it's easy enough. It's a bioidentical. You can ask your REI, or I work with a great nurse practitioner that could prescribe it for you. And you just would be looking at your LH surge. And once you surge, then give the injection that night and time your intercourse the next day.
Okay. And so what is the injection called?
It's HCG.
HCG. Oh, okay.
10,000.
Yeah. Okay. So I'm going to figure that out because that would be interesting to see if adding that to it would make a difference.
It's such an easy thing to strengthen up your ovulation.
Okay.
Especially when you're over 40. I used it to get my son. I've had 7 pregnancies. I had 5 losses.
So sorry.
Thanks. I have stage 4 endometriosis, as I said, since I was a youngster, and also Hashimoto's thyroid disease that I've really tried to get under control. I'm on a desiccated porcine thyroid that has helped quite a bit, along with low-dose naltrexone, and that's helped to lower my antibodies. But yeah, a lot of loss. And I was told after my 3rd laparoscope when I was 34 by a reproductive endocrinologist that I've known for 30 years, he's like, you're going to need IVF. And I said, well, Chuck, I'm not going to do IVF. And he said, well, you're going to need it. Otherwise, you'll never have a baby. So I showed up in his office 5 weeks pregnant after I had my students use Mercier therapy protocol on me. And he was just
blown
shocked.
Away.
He's like, yeah, shocked, but also pleased as punch to know that I got pregnant. I did lose the pregnancy at 8 weeks. But you know what? That's kind of a chance you take with endo because you're in a high state of inflammation. Your mast cells are like, hello. Yeah. But I managed to have my daughter when I was 37 and she's now 13. And my son I had when I was 41. I used a little bit of FSH injectable with an HCG trigger and timed intercourse for him because I kept losing babies.
Right. And you wanted to, of course.
So I never did IVF. I'm not against IVF if you need it, but I know what to do, when to do it.
Right.
And I can tell you exactly, looking at case by case scenarios, you come to see me, I can tell you exactly what we need to do. If it's do nothing, it's do nothing and just monitor cycles. If it's do a little bit of something, I know what that little bit of something is. And most of the REI clinics won't tell you about that little something because that's not what's going to make them
money.
The big,
essentially,
the big check at the end of the cycle. So I'm your liaison through all of it. I'm happy to help.
People aren't talking about this enough, but I truly want to optimize your health. We need to be paying attention to EMFs. We are constantly plugged in, surrounded by wireless signals, radiation, frequencies that our bodies have never ever been able to handle at this level. Research has shown that EMFs can disrupt sleep, impact cellular function, and contribute to long-term health issues. Yet we're rarely talking about this or how to protect ourselves from this. This is why I was so excited when I first discovered Lila Quantum Tech. I met them 2 years ago at a biohacking conference in Austin and was absolutely blown away by the founder, Philip Mon. Hearing him on stage and learning about quantum energy technology completely shifted my perspective. I knew I had to try it for myself. And now, 2 years later, I'm so excited to have them partner with me on my podcast. One of my absolute favorite products, the Heal 360 capsule, which I wear on my quantum necklace every day. This isn't just any pendant. It's scientifically designed and quantumly charged to support your body's natural ability to heal, energize, and protect itself from harmful influences. People using it have reported more energy, mental clarity, better stress resilience and relaxation, deeper sleep, and faster recovery. And that is also the feedback I got from our supper club when I gifted it to all our guests. Lila Quantum Tech is leading the way in quantum frequency healing with products designed to neutralize EMFs, enhance cellular function, and help your body operate at its best. I personally felt the difference since wearing Heal 360 capsule, and I think you'll love it too. Check it out at lilaq.com and use code Biohack-It for a discount. That is LEELAQ.com and use code Biohack-It. Happy healing. I'm gonna literally take my phone and show you my Anito and get you to look at my cycle. Okay, so what do we got here?
Okay, let's see. Iman's Anito. So progesterone post-LH surge is a little flat.
Which is I'm taking progesterone right now.
Okay. Let's see what your LH was at the surge. LH looks good, a little flat, and then estradiol looks really good. Estradiol should be 150 to 300 per dominant follicle.
Okay.
And yours was at 183. So well done. Well done. Let's see what we've got. Let's back up here to March. Same for the estrogen in March, a little flat on the LH. Let's see what your post-ov progesterone looks like. Sorry here, guys. I'm doing this on the fly.
We love it. We want all the real-time data
so
we can see what's going on.
Totally.
This podcast is all about authenticity, and I'm here to be I'm bearing myself out there so that other people can learn. That's the best way to do it. I was I just want to be honest.
Thank you. That's really great. So I'm also noticing that the progesterone in the luteal phase for March was low too.
Yes.
Are you doing an oral 200 milligram progesterone?
No, I'm doing a subliminal.
Vaginal?
Yeah, vaginal.
Endometrin or crinone or something?
I don't know what she's ordered me. I have to go back home and check.
Yeah. I'm around. You let me know what you're taking. I think the vaginal application of using progesterone is fine. I do like the oral application.
Okay. Even though that's not bioidentical and mainly the oral tends to be synthetic.
You can get oral micronized progesterone.
Okay.
It's Prometrium. I really like it. I think that it's well tolerated by the liver as well.
Okay.
And the thing about oral progesterone versus vaginal progesterone is that oral progesterone can make you kind of loopy and sleepy and relaxed, right? Because it's a muscle relaxer.
Yes.
It's meant to relax your uterus.
Right.
But vaginal progesterone gets messy and it kind of wipes out the good flora of the vagina.
Oh.
And if you're going to have intercourse after you've used, been using progesterone, that's very messy. So I really appreciate the oral micronized progesterone. It's not hard on the liver and it does its job. It does a great job.
And it's also bioidentical?
Yeah, it is. Yeah,
Okay.
I don't use any synthetic chemically synthesized hormones in my practice, only bioidentical, and they do a great job. In fact, I was reading a study this morning. It was the Women's Health Initiative from 2002 about using synthetic hormones and how they grouped bioidenticals into the same thing, the same kind of
category,
result.
which they have nothing to do with each other.
No,
They're
bioidenticals are magic. They're wonderful.
And for anybody listening, the difference is synthetic is obviously made in a lab. Bioidentical hormones mimic and mock your exact real hormones, which is why the body recognizes them and they're natural. And the way they're processed and made essentially is natural. So if anybody wants to start any form of hormone replacement therapy or whether they're going to a practitioner, please always ask for bioidentical and not synthetic hormones because that's where the dangers come in. That's where the study on breast cancer, where the hormone replacement therapy came from, this misunderstanding, but they were using synthetic hormones in that study, which linked and showed an increase in breast cancer, not bioidentical. Bioidentical, poor things, had nothing to do with it.
Nothing. They looked at equine estrogens and they were prescribing that in the form of Premarin. And they were using progestin, which is synthetic progesterone.
Correct.
Both garbage.
And that's the difference, that you have to work with somebody who's really educated in the space. Not all hormones are created identical. Not every woman needs to be put on everything, and the dosage does matter. So they really need to understand the context of what they're putting you on for your body's needs.
Absolutely. I mean, somebody like me, functional endocrinology is what I practice. And if you're going to calibrate a dose for a woman trying to get pregnant versus a woman in perimenopause, postmenopause, we have to know exactly what the dose should be, when to give it. I mean, I see more women in my practice that have seen, God bless them, chiropractors who call themselves fertility specialists, and they've got women on continuous progesterone, which can suppress ovulation.
Yeah.
And so I think it's really important that if you're going to do any kind of HRT, it's bioidentical HRT, and you're working with someone who speaks the language.
And so what would you do differently looking at my Anito?
I would supplement you with estradiol in your follicular phase.
Okay.
I would give you...
I was wearing patches for a little
Okay.
bit. Yes, I was wearing patches and I just kind of stopped wearing the patches.
I think that those are real helpful for you.
Okay.
I think that you should consider continuing with that.
Okay.
So estradiol in the follicular phase, HCG trigger injection at LH surge, and then 48 hours post-trigger, starting an oral micronized progesterone, 200 milligrams at bed until menses.
Okay.
Yeah. And if you're pregnant, you continue with those. And we'd have to take a look at your levels to make sure that you're dosed correctly, that you're dosed high enough to support the pregnancy.
Right. And you carried that into how many months of your pregnancy?
So Creighton University, I don't know if you're familiar, but they are a Catholic university, and they talk about using progesterone well into the pregnancy to relax the uterus, to allow for the pregnancy to just continue, and stopping progesterone at 37 weeks. I personally did that method with both of my children, and I felt great. Wow. Not only did it give me peace of mind to not lose another baby, but it also helped me to sleep during pregnancy and just be more relaxed. I think for women that have had losses, it's a nice protective mechanism just in the mind to give some extra added support. There's no harm in doing so either.
Right. And it doesn't impact the baby's development in any way, shape, or form at all.
It does not. In fact, if you were working with a traditional OBGYN or reproductive endocrinologist, you could ask them to stay on till at least 16 weeks. But most OBGYNs will tell you that there is no data to support using progesterone during pregnancy as an exogenous source.
Looking at like what data you have so far, how many treatments would you give me if I was to come down and say, hey, Jennifer, I want to come see you. What do you recommend?
You are no exception, my friend. You would have 4 days of consecutive treatment, 90 minutes each day.
Okay.
Yeah.
Back to back to back to
Absolutely.
back. And then from there, take a break, essentially? Is that how it works? Or?
No taking breaks. Are you talking about taking a break from trying?
No. Meaning 4 days back to back. And then after that, I go basically try normally.
Yeah. And then I'll tell you how I'd like you to monitor your cycles.
Okay.
I don't use the Anito app, but a lot of my patients do. And if that's something you want to continue, that would be fine. But I actually give you a journal and I teach you how I want you to monitor your cycles the way that I have found to be tried and true.
Okay.
And then getting you on the estradiol, right?
Yeah.
And then the trigger injection and then the progesterone, and just continue to go that way, but also adding in 75 milligrams of DHEA and 30 milligrams of pregnenolone each day.
So I was going to speak to you about the DHEA. So I got really mixed feedback, which by the way, I was taking a little bit of DHE prior, and one of my fertility doctors who is a bit more alternative, actually both of them, said, we don't want you on DHA. You need to get off that. And they said, we want you to get off that because the guy who came up with a lot of the research for the DHEA, it turned out he was skewing a little bit of the research. And so we don't want you to be on it. And these guys are a bit more alternative, both of them. They're actually more functional. So we want you to take that out of your supplements. And it wasn't even that high a dose. I think I was taking 25 milligrams of DHEA. So I was wondering, like, how do you utilize it in your practice?
Yeah. So Norbert Gleicher is the physician that you're talking about. I used to work for him at the Center for Human Reproduction. I think he's brilliant. And I think he's doing really great work for women that are a little bit older than 40. DHEA has the ability to falsely elevate progesterone in the early part of the cycle. So, we do need to be mindful of that and be testing, because we don't want progesterone to be the king in the beginning of the cycle. We want it to be the estrogen. So trying it in the short term for 3 to 6 months is something I recommend. Pregnenolone is the sister hormone to DHEA. It helps to become utilized in the body. I don't recommend using DHEA unopposed. I think we always have to use it with a cocktail. It's like going to the orchestra and pulling out the string section. It sounds okay, but you put the strings back, it sounds beautiful.
Right.
Right? So we have to make sure that we are minding our P's and Q's and that we've got all of the hormones plugged in and at
Working
the right
in a
time.
systematic way.
Yeah, they work together. So back to your question about DHEA and is it necessarily great or is it not great or should we do it or shouldn't we do it? I think it's worthwhile to do it. I think all of the data supports, whether it's a little bit biased or not, it supports, there's no harm in doing so. And especially when using a sister hormone like pregnenolone.
But with the other hormone in place, right? Because a lot of these functional practitioners are I have other friends who are functional practitioners who are just giving it to women, but that's not what should be happening.
I wouldn't do that. You know what? Just because it's sold over the counter isn't something to be used willy-nilly. I think we really have to be careful and use it in conjunction with other hormones. But also there's new there's new evidence out that shows that DHEA can be also miscarriage preventative.
Okay. Oh, I didn't know that. Just recently it came out?
Just recently.
From the same place?
Not the same place.
Okay.
Not the same place. So I use it a lot in recurrent miscarriages too, but I would dose it at 25.
Okay.
25 milligrams each day.
What is the highest dose you've ever given somebody?
75.
And for how long?
6 months.
6 months.
Yeah.
Okay. And what was the outcome of that patient taking it?
I have a lot of patients taking it. It's been great.
Wow.
For women that have low AMH levels. It's been great.
Okay. Amazing. I didn't know about that piece because I was told obviously that, hey, like you should. And what's your take on DIM? Because DIM is one that if you are estrogen dominant, again, a lot of fertility doctors, actually including Dr. Amy Raup, who I interviewed for my podcast, who is a TCM specialist, said DIM is not something we want women on.
I agree with that.
Okay.
I like DIM for women that are perimenopausal, menopausal to help with the proper conversion of estradiol. When we're trying to conceive, we want robust levels of estradiol to support follicular growth. So we don't need to do that right now during fertility. And
so for estrogen dominance, like I've been taking this thing called Brock shot. I don't know if you've heard about it. It's like broccoli seed sprouts essentially. And that's just helping me bind out
That's DIM. Okay, that's diindolmethane.
Is it the same thing? Because it was completely different. It's the
indole-3 carbonyl.
I have to look at the exact ingredients on it, but I think it's different. But somebody put me on DIM and they were like, no, we do not want you to be taking any DIM.
So broccoli seeds contain indole-3 carbonyl, which is DIM.
Okay.
Yeah. So I would say no for that for now.
And so for somebody like me who is estrogen dominant, right? And that like this way I have these really painful periods and I don't feel good. What should I be doing in the meantime then?
Yeah. I mean, progesterone in the luteal phase, that's it.
Okay.
You'll be using progesterone all the way up to the day that you start to menstruate, and that's extremely inflammatory protective.
Okay.
Yeah.
And that's the way to do it.
Absolutely. In my opinion, yes.
If you're spending hundreds on skincare but ignoring one of the most powerful anti-aging tools out there, you are missing out, my biohackers. I'm talking about red light therapy and Bond Charge's red light face mask. It has completely changed the game for me. Red light therapy isn't just another hype. It penetrates deep into the skin, boosting collagen, reducing inflammation, and easing signs of aging. And the best part, it's cordless, it's lightweight, and totally painless. So I can wear it while I'm getting work done, watching TV, or even making a quick smoothie for myself or taking my dogs for a walk. I've tried a lot of skincare treatments, and let's be honest, some of them are messy, others are time-consuming, or just plain uncomfortable. But this mask makes it so easy, just 10 minutes a day, and I've noticed my skin is brighter, clearer, and even more even-toned. No downtime, no hassle, and because Bond Charge products are HSA, FSA eligible, you can use your health-saving funds to invest in your skin. Trust me, you need this in your skincare routine ASAP. Right now, my listeners get 15% off when you order from bondcharge.com. Just use my exclusive code Biohack-It at checkout. That's bondcharge.com, plus you'll get free shipping and a 12-month warranty. Again, that's Biohack-It. Go grab yours now. Your skin will thank you later.
I wanted to talk to you about what is like one symptom that you see that's a massive red flag, but it goes undiagnosed so much of the time.
Always abdominal and pelvic pain. And either women feel like maybe they have endometriosis or have a family history of endometriosis, or they're just not even thinking that way at all. And they want to avoid, when I bring it to their attention or I do an evaluation of their abdomen and pelvis, they want to avoid the surgery, but sometimes it becomes necessary. to get the diagnosis, to clean up the disease, to suppress the disease a little bit with progesterone postoperatively, but then to get working immediately. When I say get working is to implement Mercier therapy protocol.
Right. And so everybody who's coming in for, whether you have endometriosis or somebody like me walking in who might not have that. So it's like the 4 sessions, 90 minutes, back to back to back. And then would I come back if I haven't conceived the following month, or would these women be coming back for it?
No. You don't have to come back. You can if you like, but you don't have to.
Okay.
So it's 6 hours up front of treatment.
Yeah.
And then I set you up cycle journaling and then with the specific protocol for you. Yeah.
And then what is pelvic floor dysfunction? Because I was so fascinated by this. I'm like, what is it and how do you know you have it?
Yeah. So women that have dyspareunia, so pain with intercourse, women that have vulval vestibulitis, so they're having pain at the vulva and the introitus intermittently, not even necessarily with sexual activity. And that would be a pelvic floor PT that works with women like that, because I don't do any vaginal work.
Okay.
There are some pelvic floor techniques that you can do on your own at home as far as strengthening the pelvic floor. But I've had couples where women cannot allow for any kind of sexual activity because they have such a tight vaginal ring.
So how are they going to push a baby out of there?
Exactly. They don't. The women that I work with, they don't. Their husbands have inseminated them with like eyedroppers or syringes at home. I know.
So how do
Please,
these poor women have a normal relationship? Like how do they, so I'm just so interested in that. Wait, so how do these women have like intercourse?
They don't.
At all?
At all.
So no.
At all.
And there's nothing that can be done about this?
Absolutely. They can see pelvic floor specialists, but you know what? If they've got things like interstitial cystitis or in the bladder, or they've got this vestibulitis and pelvic floor therapy isn't working for them, then, you know, like you've got to look at some maybe emotional therapy.
Right.
To kind of get yourself really out of the game and like out of the game of this
right.
pelvic pain. It's awful. I feel.
And how common is it? Like how many women do you know who actually have this?
Not very many.
Okay.
Not very many. In 25 years of practice, I may have seen 20 that have had extreme cases of pelvic floor issues.
And there's not a surgery or a way to stretch it out.
Yeah, you can. Yeah, you can. You can. So working with a pelvic floor physical therapist, they have dilators that can be worked with. You can, you know, work on it with your husband and, you know, just be as patient as possible when trying to stretch. But I mean, sex is in your head.
Right. Absolutely.
Right. You have to be in your head to be having sex
in your body. Yeah.
You have to take yourself somewhere different almost. You have to have the connection, but be able to allow yourself to be somewhere different when having intercourse and connecting with your partner. And if you can't do that, then maybe breaking it down with more of an emotional therapist would be the way to go. Yeah.
And these poor women, my heart goes out to them. How many of these women have gone on to now have families and kids and stuff like that you've worked with?
Yeah, almost all of them.
Oh, really?
And a couple of them of note had to go through IVF because they couldn't have.
And then they had babies through C-section, I assume.
Yeah. I can tell you that almost all of them have had C-sections because they just can't let go. Your pelvic diaphragm gets so tight and so stuck that you just can't let go enough to allow the baby to come down into the pelvis.
That's crazy.
Yeah.
And there's no way to hypnotize them or walk them through, I don't know, a breath work or anything like that lets them get into their body in that way?
I don't know. There's got to be something,
Yeah,
right?
there has to be, right?
Yeah.
What is also one of the most shocking things or shocking cases that you worked on with Mercier therapy, like since you started it in all your years?
Yeah. Her name is Caitlin, and she is in my upcoming documentary film.
Amazing.
Caitlin has had a series of abdominal surgeries, and she currently has a colostomy and wanted to get pregnant, but she had something called an obstetric fistula. This is where there's a tunneling effect from the rectum to the vagina, and she kept getting infections because the stool would sit in the space where it shouldn't be. No matter how clean of a person you are, it still is not the way it's supposed to be. So she came in to see me with her wonderful husband and so supportive, such a supportive guy. I love him. I love this couple. And we worked, and her belly was as hard as this because of all the scar tissue. we worked through it, and they were able to conceive on their own.
Naturally, completely. After how many sessions and how many?
Six.
Okay.
Six. And she monitored her cycles, and she did exactly what I asked her to do, bless her. And they ended up losing the pregnancy. They came back in. We did 6 more sessions because that's my promise. If you get pregnant and you lose the baby because there's so many miscarriages, come in, let me work with you again. They ended up having their little boy, Mateo.
Amazing.
And you'll see him in the film. But she continues to come back to me because she had to have a C-section. And we worked through all the C-section scarring. We worked through all of the abdominal scarring. And her belly is nice and soft now. And they want to try for another baby. And that has been probably one of the toughest cases I've ever
taken on.
Yes.
And then question for you, are you working from on top of the belly, or you're actually going in to the vagina and kind of like working inside?
Mercier therapy is non-invasive.
Okay.
And we work via the abdomen.
Okay, so everything is on top.
Yeah.
Okay.
And it's deep work.
And do you feel things click and move, and, do you hear sounds?
There's no sounds,
Okay.
but there's a lot of movement under my hands, yes.
Okay.
And I think that being a midwife and having done thousands of pelvic exams on women that are non-gravid, that women in labor, women that are postpartum, I've been able to develop a skill where my hands can be quite sensitive to feeling different scenarios. And yeah, I can feel movement of pelvic organs under my hands when I'm working. It's incredible. It's a gift. And it's taken many years to kind of hone in on exactly what I'm feeling. But to answer your question, yes.
The intuition is you can feel something and be like, that's like what's going on.
Absolutely.
And then what about when it comes to actually like taking care of your reproductive organs and your pelvis and all for when it comes to longevity? Because this is all the biggest thing I've learned on my journey is, and you can tell me what you think, that there's a direct correlation with everything that we try to do for longevity when it comes to extending ovarian aging and the health of your ovaries and all of that stuff. So whether it's the supplements you take to slow down aging with like rapamycin, or it's the protocols that you do that help reduce inflammation, monitor your glucose levels, improve mitochondrial health. These are all longevity hacks that we as women want to do, but those are the ones that directly impact fertility as well and slowing down ovarian aging. So from that perspective, how do you think women should be utilizing your therapy just for aging well and being healthy?
We don't go to the gym just one time. We continue to go to the gym. We continue to step up our game. We continue to custom tailor our supplements, and we custom tailor our eating and all of our relationships.
Right.
It's a constant thing that we have to keep after. So how do we keep our pelvic organs from shriveling up and going away post-menopause? We have to do the work. And so I recommend maintenance treatments, coming in maybe once a month or once every couple of months to do a session just to keep things mobile and communicating with the hypothalamus and pituitary gland and all of the endocrine system healthy. Just as you'd check your thyroid panel, you should be checking it once or twice a year at least, a full thyroid panel. We have to keep up with working out our pelvic organs.
Right. And how many practitioners have you trained now? I know that you're in 23 different countries. How many practitioners have you trained across the US, and which states can people find the most practitioners trained by you?
Yeah, so there are about 250 in the United States.
Okay.
Unfortunately, most of them haven't kept up with my recertification standards.
Okay.
And so there are very few that I would refer women to go see. And that's why I developed the 4-day condensed treatment protocol for women that are coming in to see me from out of state or out of the country, because I can't put my name on something and refer to somebody that's not really doing the work.
And so women, where do they fly in? And do you, like, for people coming from out of town, if women are listening to this and they don't live near you, does your team kind of help them find somewhere to stay and all of that stuff as well?
So we have recommendations about little Airbnbs in St. Charles and Geneva, Illinois that are charming and wonderful. And we have a very safe area. All these cute little restaurants around and beautiful little stores and things.
Yeah.
And so, we will guide women on where to stay and what to expect and what to do. And at the end of my first session with women, I usually say, hey, what do you have on your mind? What do you want to do for dinner? And send them off to a really good place.
That's amazing. So they can have a little experience essentially out of it. But more likely not, don't come in the winter, come in the summer.
If you want to come to Chicago in the winter, be prepared. Be prepared.
Cold. Yeah. It's maybe not a good time to go in the dead of winter at that time.
Or maybe you want to. I don't know. Whatever is on your heart. But yeah, it is an experience. And I always tell women to take the time for themselves to relax after their treatment, to nourish their body, maybe to, have some juice or just eat some really good nourishing food. And they always say on the 4th day of treatment with me, it's over already.
If you know me, you know I avoid seed oils like the plague. They're everywhere, even in snacks labeled as clean, organic, or healthy. But the truth is, they wreak havoc on your metabolism, your hormones, and make you super inflamed. That's why I'm obsessed with Prima, one of the few products I completely trust. Prima was created to push back against processed artificial foods and bring us back to real, nutritional, ancestral ingredients that actually nourish your body. It's packed with 100% grass-fed beef tallow, grass-fed collagen, and grass-fed whey protein, delivering bioavailable nutrients for muscle recovery, joint health, and overall vitality without any of the junk. No seed oils, no refined sugars, no artificial additives, and the best part, it's one of the few products that is certified seed oil safe. I always keep Prima stocked in my bag. It's my go-to post-workout, between meetings, or anytime I need an easy, high-quality protein boost. Getting in at least 1 gram of protein per pound of body weight can be really tough, but it's essential for building and maintaining muscle as you age or going through a fertility journey in your 40s and 30s like I am. And the flavor is delicious. Cacao, mocha, and salted caramel. You really can't go wrong. My favorite flavor is the salted caramel, plus the Prima bars are sweetened with organic raw honey and only contain organic whole food ingredients. So you're fueling your body with real clean nutrition. Because you're part of the Biohack-It community, you get 20% off. Just use code IMAN20 at eatprima.com. Ditch the seed oils, fuel your body right. You will feel the difference, I promise.
Do you also put your patients coming in on some sort of a diet protocol?
So what I recommend is Whole30.
What's Whole30?
Whole30 is primal eating, real food.
Okay.
Just real food. And I don't say, gluten-free, dairy-free, all of this, because I want women to be compliant and I want them to enjoy the process. So trying to inflict or instruct on rigid diet recommendations, I just say Whole30 because it's real food.
Okay. And so Whole30 involves what would a standard Whole30 diet look like for one of your patients? If they're like, Dr. Jennifer, give me what I should be eating in that Whole30, suggestions, recommendations, what would they be?
Grass-fed beef, free-range chicken, free-range organic eggs, fruits and vegetables that are organically sourced. Just nothing that would be outside of a 5-ingredient
list. Yeah.
So
if you're buying something at the grocery store, read the label, make sure it's not more than 5 ingredients. And those 5 ingredients are natural, no natural flavors, no gums, no dyes, none of that.
No seed oils.
No seed
oils.
Oh
my
yeah,
gosh.
because that's so inflammatory.
Seed oils are in canola oils and everything.
Oh
and they're disguising it now and saying rapeseed oil.
Yeah,
and
but same thing.
It's the same thing.
Rapeseed oil, canola oil are equally inflammatory seed oils. Yeah, it's the same thing.
It's the same.
Yeah.
And they're inflammatory in the body. And no wonder people are so obese and people are so unhealthy looking and looking like they're time bombs because they're eating garbage.
I always say, I think there are only 4 to 5 oils that anybody should have in their house. So it's like tallow, butter, avocado oil, and olive oil and coconut oil.
Yes.
And that's it. Those are the 5 oils you need. You don't need any other oils in your house. I personally, in my house, we love to cook with ghee and butter.
Yeah.
That's our preferred thing to cook with. We like the healthy fats. But if that's something you don't like, then these are the only 5 oils you need in your house. There's nothing else that is required. If it's anything but those 5, you are poisoning yourself.
That's all I have in my house. I'm eating butter all day long.
Yeah, I eat sticks literally of butter. And people look at me like I'm crazy. And I'm like, you know what? I haven't gained weight. It's actually working really well for me because most women are not taking in enough fat.
They're not.
And that's another big problem. Is it true or not that most women are not taking enough fat, which is also leading to infertility?
I 100% wholeheartedly agree with that. I think women that they want to stay away from fat. They don't want to get fat. And it's like, oh geez, these wonderful fats are not going to make you fat. They're going to make your brain, a lot more. It's going to
alive and kicking in your body, feels like I'm nourished and I'm taken care of. And the beautiful thing about these fats also is they burn slow. So they keep you fuller for longer. It's like protein, right? When you have the right adequate amount of protein, you feel fuller for longer. Now, if you are fuller for longer, your blood sugar levels are more stable for longer. So you're not having these spikes and then crashes because you're stabilized.
Right. That's so true. This is the example I give. If you start a fire and you throw some paper on there to get it started, it's going to burn fast. But if you keep the logs burning, it's going to burn slow. So the carbohydrates, the simple carbohydrates, the sugars, that's the paper on your fire. Sometimes you need a little bit, but the logs is the Kerrygold butter.
Yeah.
It's the avocado oil. It's the coconut oil. Yeah. It's the good slow burn.
Grass-finished meat.
That's right. That's right. And then your glucose to insulin ratio will balance out, and you won't have these crashes where you're going to need to eat another donut, another cookie, another piece of chocolate.
What are you doing for your patients' insulin levels? Like, because some of these doctors are also doing GLP-1s. I mean, there's natural forms of GLP-1s, but what's your take? Like, what are you giving patients?
If we really need to use something like a GLP-1, we won't use GLP-1. We'll use tirzepatide.
What's that?
GLP-1 GIP.
Oh.
And there are less side effects from using tirzepatide, which is
and
Zepbound.
It's also, you buy it, you have to get it prescribed?
Yeah, it's a prescription.
Okay.
And using it microdose. So I don't know if you know Dr. Tina.
Yes.
Okay,
I love Tina. Yeah.
Dr. Tina will talk about microdosing it. And I agree with that. I think it's a really good approach. The manufacturer says to use a much higher dose than like Novo Nordisk. They'll talk about using a much higher dose of semaglutide or Ozempic than what people really need. And then they get these extreme GI symptoms that are ridiculous.
And when we're taking microdose, like low dose, how low are we talking? Like, what are they taking?
Like 1 milligram.
1 milligram a day or a week?
Once a week.
Once a week.
Once
okay.
a week.
1 milligram once a week. Okay.
And these drugs are not meant to kickstart weight loss. They're meant to be on for a lifetime. So if we're going to use it just for a short period of time, microdosing actually has been proven to be very beneficial.
Okay.
Because women will feel the satiety decrease, and then they can keep up with that once they're off of the tirzepatide. Do I recommend that for every woman? Absolutely not. Do I recommend it for women that are trying to find an outlet to get their insulin to glucose ratio balanced because they are poor eaters? Yeah, but they're going to have to modify all of that. You can't eat poorly and still just expect the medication to take over.
And then how many of your patients are you putting on this versus are there any natural like alternatives to GLP-1s that you recommend or suggest?
Yeah, high fat.
Okay.
Just, eating butter literally all day long. You don't have to eat like a whole stick of butter in the day like I do. But I put butter in my coffee. And it's got to be the right butter, right? Yeah. It's got to be the grass-fed.
Grass-finished,
grass-finished butter.
And that's another thing for anybody listening. You can tell the quality of your butter. The more yellow it is, the like healthier it is for you. The more white it is, that's processed and you don't want to be doing that. So when you go to the grocery store, Kerrygold is a good one. If you have a farm near you and they do grass-fed, grass-finished, that's a really great way to source. But you want your butter to be yellow.
Yes.
That is a sign of good quality butter, not white.
Correct. Yeah. Good point. I just take a little bit of butter every time I go to the kitchen in my office. I'll just take a little bit and I'll just put it in my mouth and
that's it.
Let it burn slow all day long. And then typically I don't have to eat as much all day,
Absolutely.
you know?
Yeah,
and then
it stabilizes your blood sugar.
Absolutely.
And keeps you kind of fuller longer.
For sure.
I am so excited I got to sit down with you because I followed you literally since, September, October last year, and just learning about the Mercier therapy. And I see you posting about, your patients and they're sharing their pregnancy tests. And for me personally, going through wanting to do a holistic fertility journey, fingers crossed I get there on the other side, is just so rewarding to see. And personally, from my perspective, I think more women need access to practitioners like you and your therapies because there's alternatives out there. And we shouldn't all be cattle down this lane of IVF or nothing because that's not the right fit for everybody. I personally chose it. There was nothing that I was told not to do IVF. I just said, I don't want to do it. It's a very, very personal choice. I appreciate the work that you do and the patients that you empower and the women that you help create their families.
Oh, thank you so much. It's my whole heart.
And you do an amazing job at it.
Thank you.
And I see how you share all your amazing patients and they're sending you stuff. And I'm like, Jennifer's amazing.
Thank you so much. I love them all. They become like family to me. Yeah. They're all very special people. And when they are willing to share, it brings me a lot of joy because I've been in their shoes. Yeah. And I just want the joy to be spread to all of the women and the hope. And just to know that you don't have to commit to something so invasive, first of all.
All the time. Yeah.
All the time. Yeah.
Right. Oh, thank you for being on the show. And thank you for traveling down to do this with me and just sharing your light and your knowledge with everybody here. I appreciate you.
My pleasure.
Where can people find you?
Yeah. I'm on Instagram.
Okay.
dr.jennifer.mercier. And then my practice website is expectamiracle.life.
Yeah. Really beautiful name for the website.
Thank you.
Thank you so much.
Thank you for tuning into Biohack-It. If you've enjoyed today's episode, please don't forget to subscribe, rate, and leave a short review. It really helps us reach more listeners just like you. Follow us on Instagram at biohack-it for exclusive content and the latest updates. Remember, your health is in your hand and curiosity heals.